इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
वाह।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
अरे इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. It is said that our liver does more than 500 vital processes for our overall health. So it is important to maintain our liver at its maximum efficiency. What are the signs and symptoms of liver damage? What happens if our liver is damaged? Can we repair it? We are bringing you Apollo's liver expert Dr. Murugan to a live session today, Apollo 24/7's Health Hour. You can ask all your questions and queries relating to liver health. Join us today 11 a.m. on Apollo 24/7's Health Hour and we shall bring answers for your queries. Also on the show you can win coupons and prizes from Apollo 24/7. So we are waiting to see you there 11 a.m.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. Every week we bring you an Apollo's expert to your homes. We bring you an opportunity to ask your health related queries in the live show. So get ready. Today we are going to talk about how to take care of the liver, which is very important. So get ready. Please type your questions in the YouTube chat box and we shall take the questions once our expert comes in. And today we are going to welcome Dr. Murugan, who is a senior consultant hepatologist at Apollo Hospital Greams Road, Chennai. He'll be joining us very shortly. And also on the show, you are going to win some coupons and we are going to have a health quiz. I urge you all to download Apollo 24/7 app, which is beneficial. Also, you can, there are one or two questions which may be related to Apollo 24/7 app. So all the coupons can be used there. So better download the app beforehand. All right, let's start the show today by this wonderful, let me talk about this wonderful initiative called Saving a Child's Health Initiative. Saving a Child's Health Initiative, in short, which is called SACHI, is free pediatric consults for every child in need. In association with Apollo 24/7, SACHI is on a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 plus pediatric specialties who are renowned Apollo pediatricians are benefiting children across India. Scan the QR code which is on the screen to know more about it and please spread the good word. Chalo, let's start talking about liver today. I know a lot of people are waiting and a lot of questions are already there. So keep typing your questions. We shall take them very shortly. Joining us now is Dr. N. Murugan, Senior Consultant Hepatologist at Apollo Hospitals Greams Road, Chennai. He has vast experience over 22 years as a hepatologist. He's received Best Doctor Award from TNMGR Medical University, Fellowship in Hepatology and Liver Transplantation from USA, published in major national and international journals. And this Sunday morning, he's here to answer all your queries. Good morning, Doctor. Namaskaram. Welcome to the show.
Namaste. Good morning.
It's a great honor having you on this show, Doctor.
Thank you. Thank you. It's my pleasure to be here.
Thank you. And understanding that liver is key, the vital organ for our health. Can you please explain us why it is so important and what are the major functions that our liver does?
Yeah, you mentioned in your introduction that liver does about 500 functions. So it is really like the motherboard of a computer. It is a metabolic powerhouse. So almost every cell in your body needs nutrients and the liver takes care of it from the food that we eat. And that's how the food is processed and the liver is central to that. Apart from that, it makes a lot of proteins that the body needs. It forms a defense for infections. It removes harmful substances, poisons, toxins, drugs. So yeah, it's a very important organ and it does a lot of functions.
Great. So we don't even know what it is doing. And also, once the liver disease sets in, it's also said that it's silent. What are the common issues that a liver can face and how dangerous are these?
So mainly there are infections that affect the liver, and when you get an infection or sometimes exposure to drugs or medicines, there is an inflammation of the liver that leads to jaundice. So jaundice is something many people understand when you become yellow, and mostly it comes from viral infections. Of course, harmful substances like alcohol, when you take too much of it, can damage the liver. And apart from that, another important damage to the liver is fatty liver disease, which is increasing in our country, very common, and that can also be harmful to the liver. So these are some of the common things that we see that affect the liver.
Done. So what is while we hear that liver can regenerate or repair itself, but that's not the end. It is also not something that it is forever. It is also invincible. What is the damage that cannot be repaired?
Like you said, the liver has a great capacity to repair itself. Most of the time it can, and you can go down to 20-30% of liver function and still be all right. So it's a wonderful capacity to do that. But anything that is beyond its capacity, then it gets damaged. One of the conditions that you probably alluded to is called cirrhosis of liver. This is a condition where, due to various causes like fatty liver, alcohol use, viral hepatitis, these are the common things that cause cirrhosis. Gradually over the years, over a period of 10, 15, 20 years, the liver becomes hard, it becomes nodular, and it's trying to repair itself, but it repairs itself by fibrosis. Fibrosis means scar tissue. So it cannot function like a normal liver. And this condition is important because it is irreversible. It cannot be completely reversed. And gradually the liver will lose its function. And when the function falls below 20-30%, then the patients have liver failure and they can die. So it is a serious condition, and it can happen in certain conditions.
So, while you are talking about certain viral infections and especially hepatitis, are there other types of hepatitis as well, and who needs to be worrying?
So hepatitis is, we term viral infections that affect the liver as viral hepatitis. There are two groups of viral hepatitis. One group is called hepatitis A and hepatitis E. So just alphabets were given because there were so many viruses, and we have come up to G, but the important ones are A and E. They are coming through food and water. So it is like a food illness, and if you get the illness, then the liver gets inflamed, and during that period where the liver gets inflamed, patients feel sick like any viral infection. They have fever, feel unwell, and more importantly, they get jaundice, where the body becomes yellow due to accumulation of a protein called bilirubin. Luckily, the viral hepatitis is usually self-limited, which means the body can heal itself. You don't need any special medication. And 99% of the time, the liver can heal without any major consequence. But there is a small group of patients who may go into liver failure. The other group of viral hepatitis is called hepatitis B and hepatitis C. These two are spread through blood products, and needles, instruments, and so on. And they are dangerous in a way because they stay in the body for many years, and gradually they can damage the body, causing inflammation, fibrosis, and lead to this condition called cirrhosis we just talked about. It can also lead to liver cancer, liver failure, death. So it is in a way dangerous, but there are good treatments available for all of them. So it's all is not bad news. There are good treatments that we can use nowadays.
Done. So, if hepatitis is a virus, then definitely the vaccine that we have for hepatitis, I'm sure there must be science and technology which is trying to develop vaccines for a lot more
Yeah.
whatever specific viruses. But what are the vaccines which are available for hepatitis right now, doctor?
So right now we have hepatitis A vaccine and hepatitis B vaccine. For C and E, we are unable to do vaccine. Probably it may not come in the near future. But right now, A and B are available, and most children are getting it in the last 15-20 years.
All right. So, who should get a vaccine done, doctor? And which age?
I think literally everyone, all children are recommended to take the vaccine from birth onwards. So hepatitis B usually is given in the first 6 months of life. It's included in the pediatric vaccination schedule. Hepatitis A is usually given for school-going children. Like I mentioned, the vaccination became widely used in the last 20 years or so. So there will be a lot of adults who are more than 20, 30, 40 years old who may not be vaccinated. So it is not compulsory, but if you want to avoid hepatitis A and B, yes, you can get vaccinated.
Done.
Anybody can.
And now, now the one of the most important disease, which is very common, which is called the fatty liver disease. What are the types of fatty liver disease, and why is it so rampant in Indian population and across the world as well?
Yeah, so fatty liver is a very common problem. Every third Indian has fatty liver. So yeah, it's as common as that. And India is rapidly rising in terms of percentage and numbers compared to the rest of the world. Since our population is big, then the numbers are going to be big. So every third Indian in a 1.4 billion, you can imagine the numbers. And obviously the urban population has more fatty liver than the rural population. Fatty liver can come from excessive alcohol. So alcohol induces liver fat. But this is something public may not know, that people who don't drink at all can also get fatty liver. Many women who don't drink will get fatty liver. Unfortunately, the women get a little more affected in terms of cirrhosis compared to men. So the fatty liver that comes without alcohol is due to lifestyle change, lifestyle related problems. It's basically excess fat in the body, and you get a condition called insulin resistance. So when you eat sugar or when you eat carbohydrate based food, the insulin is required to take care of the carbohydrate and use it for cells, but it cannot do that. So the excess carbohydrate is then converted to fat and stored in the liver. So obviously, when we eat too much of carbohydrates, most of Indian food has carbohydrates, and we don't exercise to utilize the excess calorie that we take, then we start accumulating fat in our body. So as you age, your belly fat starts increasing, the liver fat starts increasing, and unfortunately, in the liver, the excess fat in some people can lead to inflammation, scarring, and cirrhosis. So around 20% of patients with fatty liver can develop cirrhosis in their lifetime. So it is 1 in 5. So it is a bit worrying, and we are seeing more and more patients coming with cirrhosis in the 40s and 50s who don't take alcohol, but they have all the lifestyle disorders like diabetes, obesity, high BP, and so on. So they are all
So
linked
this
together.
largest link that we can relate to is our lifestyle that we have
Yeah,
rapidly
definitely,
changed
definitely,
these days, and that's the onset of the liver diseases.
definitely,
And
definitely.
understanding that is very important. 19th of April, that is tomorrow, no, day after tomorrow, we are celebrating the World Liver Day. So it's important to understand and spread awareness
Yeah,
about how to take care.
sure, sure, sure.
And doctor, as you were talking, you were talking about metabolic disorders like obesity or diabetes. What happens if the lifestyle contributes to a liver disease, and if that is untreated, what are the other effects of ill health on the body?
So, because they are all linked, you can get all the ailments that lifestyle disorders can do, and the biggest threat is heart disease. And even patients with fatty liver disease have a higher risk of heart disease and death. They can get diabetes either before or after fatty liver, and of course, obesity. And all of these are risk factors for cancer development, not just in the liver, but in the rest of the body. So I would say the big threat from lifestyle disorders, obesity, fatty liver, are heart disease and cancers. Both can occur.
Right. So
Apart
watching,
from damaging the liver.
yeah, watching weight becomes really very important. Exercising
Yeah,
and
I think
right
it's very
diet.
important. Yeah, I think it's very important. Unfortunately, we pay less importance to it. And our lifestyle is now eating, enjoying life, watching movies, sitting around at homes, eating and drinking. So that's become more and more a lifestyle, and we do less and less work. I think once upon a time, our ancestors had to do physical work just to live. They had to toil in the fields to make food, they eat. That's how they spend their time. Now we have excess of everything, and then the money we earn we have to enjoy, and then all these things have changed. This is across the world. I don't think it's just unique to India. It's across the world, and the biggest capital of obesity is the US, which is a very highly developed country. So I think the more developed a nation gets, the fatter they get, I think. So there are epidemiological links to being developed as a country and the increase in obesity. So it is a true fact.
It is alarming, doctor, and I think it's
Sure.
time that we all shift our focus to how active that we all can get and how can we
Sure.
spread the awareness. Understanding that also lifestyle and substances, alcoholic substances, that can create issues with liver. What is too much? How much is allowed? If it is allowed, how much is allowed of alcohol?
Yeah, anything in excess is bad. There is a nice saying in Tamil, "Alavukku meerinal amritamam visham," which means even the God's portion can be poison if you consume too much of it.
Right.
Alcohol is certainly not God's portion, but it is a poison because the liver has to clear the alcohol, and liver looks at it as a chemical. It has to break it down. It makes a byproduct called acetaldehyde, and that then eventually cleared by the body. So when there is too much alcohol, there is too much of acetaldehyde, it cannot be cleared, and that further causes other chemicals that start damaging the liver. So this is a chemical process. So the more you drink, the more this happens. And if you keep on doing it, if you keep drinking daily, this will keep happening daily, and then the liver will get more and more and more damaged. Still, the liver can repair itself. We see a lot of alcohol patients come with very bad liver disease. They stop drinking, take medication, and they can completely become normal. So the liver allows you to, be a second chance or a third chance even.
Acha,
But
forgive
beyond
him,
the
God.
point, yeah, it is. So beyond the point, yeah, it cannot do. Then you get cirrhosis. So you asked about
Catch
what
it.
is the correct safe limit. Scientifically, there is a safe limit for alcohol, which is like 2 drinks per day. So if somebody asks a doctor how much can I drink safely, the best advice is don't drink every day. Have 1 or 2 days in a week where you would like to drink, or even less, and don't drink more than 2 to 3 drinks at a time. If you stick to this, mostly you'll be okay.
Wonderful. Thank you so much for all this information, Doctor. I want to start off with the YouTube chat questions with Mr. Sanjit Kumar Das Mahapatra's question. What are the
Okay.
symptoms that a liver is affected? What are the signs that one has to watch out for?
So there are two parts. One is in the acute infection or injury due to medication, alcohol, etc. So when the liver gets inflamed suddenly and there's a lot of damage, you get jaundice. That is the main symptom. Apart from that, there's only general symptoms like abdomen, stomach pain, little bit of nausea, vomiting, just feeling unwell, and so on. But the key that it is a liver problem is the onset of jaundice.
Right.
Apart from that, there are no specific symptoms that say this is due to liver. In the chronic liver disease, which is viral hepatitis B, C, fatty liver disease, even alcoholic liver disease, which happens gradually, unfortunately, there are no symptoms while all the damage is happening. So the damage happens over a 10 to 20-year period. In that period, mostly you won't have symptoms. At the most, if you dig deep, the patient will say, I'm a little bit more tired than I used to be. I feel slight discomfort in my belly. But these are passed off as nothing. All of us feel tired due to work, stress, whatever. So it's passed off as nothing. So that is the danger of the liver. The liver is forgiving, but because it's forgiving, it doesn't produce any symptoms. And then when the damage is more than 80%, then everything kind of breaks down. And this is typically what we see in practice. They just come. So in the chronic liver diseases, there are no specific symptoms, and you may not have any symptoms. So the only way you will know is by doing regular tests. So you don't have to test just for liver, but as part of a general health checkup, you can do tests once a year or once in 2 years, which usually includes an ultrasound and liver blood test. So with this, mostly you should be able to detect any early stages of liver damage. Then with that lead, you can do further tests and get yourself treated.
Done. And here, as you are giving an answer, I was scouting through the YouTube chat. 90% of the questions are related to fatty liver. So let me combine a few questions and place the questions to you, Doctor. Aarti Jadika, A. Ghosh, all of you are asking about fatty liver. Aarti Jadika is asking, grade 2 fatty liver, is it dangerous? Ghosh is asking how to cure fatty liver disease, what steps? Diagnosed with fatty liver disease, what can I eat? And what are the common, Mithun Chakravarti is asking common food habits to reduce fatty liver. So let's talk
So I'll
something
try
about
to combine I'll give some general advice about fatty liver so that will answer all the questions. So like I mentioned, around 20% of patients with fatty liver will go on to get liver damage. The remaining 80% may have fatty liver, but they may not actually get liver damage in their lifetime. But which 20% you don't know. You could be the unlucky one or the lucky one, so you don't know. Also, I mentioned that fatty liver can lead to heart disease and cancers over a period of time, again in a small percentage. So, what you can do to help yourself and reduce complications, one is you need to understand how your liver is. So, you can't do that. You need to go to a doctor and get it checked out. So, just doing an ultrasound and grading the fatty liver is not enough. There is a combination of tests we use to.
I am unable to hear your voice. Doctor, am I audible to you?
Of course. What are the risk factors for fatty liver?
I think we lost your connection in between.
Okay.
Yeah,
Are
now
you okay? Am I okay now? Sorry,
yeah,
I'll start
now you're
again.
back.
So
Yes.
we need to understand at what stage the fatty liver is. So we need to identify all the risk factors, whether you have diabetes, cholesterol, high BP, what is your weight, are you obese, and any risk factors have to be dealt with. Second is you have to do liver blood tests and rule out other liver conditions like viral hepatitis to make sure that there's nothing else affecting the liver. And third is deal with the fatty liver itself. So if your liver is a little bit damaged, then go to a specialist and get treatment. If your liver is okay and it's just fatty liver, then you have to cut down on your fat diet. You have to cut down on your carbohydrate diet. Make sure your weight is adequate and exercise. So these are simple ways to reduce fatty liver. Many patients just want pills. They just say, give me pills to remove the fat. Unfortunately, there are no pills like that. Some people want surgery, like bariatric surgery, just do surgery and remove all the fat. Unfortunately, everybody wants shortcuts. We just want to do our lifestyle, be as we are, but all the problems should be taken care of. Sometimes it's possible, sometimes it's not. Sometimes we have to work at it ourselves. So it's lifestyle modification that is the best treatment for fatty liver. So don't go by just one test and look at the grade and get worried. You have to look at it comprehensively. And whenever you have doubts, go to a doctor and seek for advice.
Doctor, while you're talking about tests, I'm also finding a lot of people are asking for, what are the levels. Sheetal is asking my blood test value GGT 89, SGPT 61. Aarti is asking, what does it mean if GGT is high? A lot of people are asking, what are these and how do they relate, and what is called a disease?
Yeah, sure. That's what I mentioned, that you have to combine several factors together, which ideally a doctor should do for you. Actually, we are actually working on an app where patients can be given better guidance. So watch out for it. You may get one soon, because at least they know when to seek help. So we are working on something. So let us see. But basically, it is a combination of your weight, your risk factors, the scan pictures, the liver blood tests, and the age. So a combination of this will give the risk for each patient. And then based on the risk and the stage of the disease, treatment can be offered. We use advanced techniques called fibroscan, which will measure the amount of fat and any thickness or damage to the liver in a more detailed fashion. So anybody with fatty liver, where the liver blood tests are also not normal, can get a fibroscan. So with this combination, ideally a doctor should guide you as to what stage you are and how we can treat you based on that. Medication are there to heal the liver if it is damaged. So medication is not there to just remove fat from the liver, but if the fat is causing some damage to the liver, that can be healed through medication. So you have to be very clear on the difference of that. But if you simply want to improve your body condition, you want to remove fat, then you have to change your lifestyle and be healthy, cut your weight down, and then the fat also will come down.
Okay, so now Chiraksha is asking, AST and ALT are above 50. Is it a matter of concern with hepatitis B?
So it's very hard on a public forum to talk about numbers. Like I mentioned, it's not just one test and then we tell this or that. It is a combination of several things. So anybody with an abnormal blood test and fatty liver, I recommend you see a doctor near you and take advice, preferably with a specialist dealing with liver and fatty liver.
And Dr. Murugan can be contacted on Apollo 24/7 app as well. Divya Botra is again asking something similar. Globulin is 4.4. What does it mean and how can I control it?
Sure. It's very hard to individualize treatment on a forum like this. So again, I can only re-emphasize there is a set of tests called liver function tests. There are about 7 to 8 parameters in the liver function test. So if any of them are abnormal, you are worried, and you also have fatty liver or any change on the liver. So you do two tests. You do a liver ultrasound of the abdomen, and liver function test. If any abnormality is there in either of those, you really need to consult with the doctor. It may be nothing. Every test that is abnormal doesn't mean you have a disease, but it's for the expert to analyze, assess your risk factors, and maybe just a simple lifestyle change, cutting your weight down, eating the right, cutting down on your alcohol, that may be all you need. So you need to work it through, get a diagnosis, and then focus on what you need to do.
Doctor, with your permission, to all the audience who are watching this live on various platforms, we'll be taking questions only on YouTube chat, and I see that there are a lot of questions today on YouTube chat. Due to the pressure of time, we might not take individual questions, and especially questions which are very personal. So Dr. Murugan is going to answer and club questions which is going to benefit people in a large number. I hope you understand that, and we'll continue with the questions. Mr. AK is asking this question. Doctor, what is the stenosis of liver? I suffer from IBD, inflammatory bowel disease, and I'm a vegetarian, unable to take metformin prescribed Providac for IBD. What is stenosis?
There is no stenosis. I'm wondering whether he means cirrhosis of liver.
Could be.
We discussed that in our discussion earlier.
Right.
There is no liver stenosis. Cirrhosis of liver is spelled with a C. That is a damage of liver due to various conditions like fatty liver, alcohol, viral hepatitis. And once you have cirrhosis of liver, some of the medication cannot be used because it can harm the liver. So that you have to work it with your doctor, what medicines you can take. There are always alternatives. For any disease, there are alternatives. So even if you have liver damage and certain medication are restricted, you can consult with your doctor, he can consult with the liver specialist, and they can find something that suits each patient. We do that all the time at our hospital.
Chetan Goenka's next question is transplant necessary for liver cirrhosis?
Liver transplant is a treatment option now for liver failure. So when patients get cirrhosis, again, I mentioned it briefly in a chat earlier, that once the liver gets damaged beyond a point, it cannot repair itself. And when the function of liver comes very low, less than 20%, you get liver failure. And liver failure, many patients will die in a short period of time. So at that stage, as a life-saving procedure, liver transplant is extremely good. It is a good treatment option. It is being done quite a lot in India in the last 10 to 12 years. We started doing transplant about 20 years ago. I'm proud and happy to say that Apollo is a leader in liver transplant. We started in 1998 and we're still doing it. But in the last 10 to 12 years, a lot of centers are doing liver transplant. It is a good option. So definitely patients who have liver failure who need it, certainly it is an option. There are many cirrhosis patients who can remain well on medication and support for many years, even 10, 15, 20 years. So not all cirrhosis patients need transplant. And again, that is the beauty of the liver. It is a forgiving organ. It can be totally damaged and still keep working, chugging along, helping you to carry on with your life. And some patients, unfortunately, reach a stage beyond that. And we just give them a new liver and they can carry on for another 20 years.
Done. Mr. Naziruddin Sheikh and Arun Kumar, both of them are asking about cirrhosis and transplant and taking care. I'm a patient of liver cirrhosis since 5 years. A doctor has suggested me for liver transplant. Can I care for my liver without transplant?
So I just mentioned that if you are in liver failure, then transplant is a better option because liver failure patients will get complications and suffer in a short period. There are different stages of cirrhosis. So patients with the first stage, which is called child A, they can carry on for many years without transplant. Those who go to second and third stages, child B, child C, they probably require a transplant within a period of time. So again, you probably are consulting a doctor, so you can consult your doctor and take the necessary steps to do a transplant.
So here's a question about hepatitis B. How do you cure hepatitis B?
Hepatitis B, there are two forms of hepatitis B. In the acute hepatitis B, many times the body will take care of itself. In a chronic hepatitis B, there are medication to control the virus and prevent liver damage. Sometimes in chronic hepatitis B, the virus cannot be completely removed, but it doesn't matter because there are good drugs to control the virus. And with that, we can manage the patient without much complications.
Done. Here's Parvati Tangirala's question. How to lower the bilirubin count?
There is no drug like that. It really depends on why the bilirubin is high. So the diagnosis has to be made, and accordingly the treatment has to be given. So just for bilirubin, there is no drug just to reduce bilirubin.
Okay. Arivalagan is asking this question, doctor. What is small, simple, multiple hepatic cysts in liver?
Cysts are basically fluid-filled cavities in the liver. Most of the time, it is harmless. Sometimes it can cause problems. So again, this is a very individualized question. So basically, a liver specialist has to see the patient and give advice.
Done. Aditya Gupta is asking, having chronic hepatitis B, I have lost more than 10 kgs in 1 year. How do I gain my weight back?
Can you repeat the question? There was some disturbance here.
Yes, I'm sorry. Aditya Gupta is asking, having chronic hepatitis B, I have lost more than 10 kgs of weight in 1 year. How to gain weight?
Oh, gain weight. Okay. You just have to take good nutrition, I guess.
Okay, that should be sufficient. And once the chronic hepatitis B can be cured, and how long does it take, doctor? Once they are out of hepatitis B, will they be able to get back to normal weight and metabolism?
No, chronic hepatitis B itself is not a major issue because it can be taken care of. So, if a patient has a specific problem, again, it needs to be worked out with the specialist. What the problem is the liver damage, is there other reasons? So, chronic hepatitis B itself does not cause weight loss. And there are drugs to control the virus, and the virus can be controlled quite easily. So there are good medicines available. So if you meet your liver doctor, they will be able to help you.
All right. Here's Chaitanya Devabhaktuni. I have delivered a baby on October 21st, and now I'm diagnosed with PCOD, and also my liver is enlarged to 17 centimeters. Do I have to worry about it?
Again, PCOD is a condition which a gynecologist will treat. An enlarged liver, commonest cause is fatty liver. So again, we need a diagnosis. Just an enlarged liver is not something that we treat. The doctors have to work out why it is enlarged. So you need certain tests to find out why it is enlarged. Again, you have to consult a specialist and take it forward. Just having an enlarged liver doesn't mean it is going to harm you. You need to know why, and then accordingly you can take the treatment for it.
Right. Kumar Abhishek is asking, my father is 55-year-old diabetic and has been diagnosed with DCLD a few months back, and he has been suggested to go on a salt-free diet with 1 liter of water per day. Will lack of sodium have any ill effects?
What I understand from your question is that your father has cirrhosis of liver, and it looks like it is in a higher stage, either stage B or stage C. At that stage, many patients have complications, and one of the main complications is retaining sodium and water in the body. They start getting swollen belly, swollen legs. So at that stage, along with other treatment, the restriction of salt and water is usually advised. So these are very specialized treatments, and it is again has to be individualized and has to be dealt with by the treating doctor. So you just need to talk to your doctor and take advice. Just consider to see a liver specialist and take the advice. They usually, the doctor will know when to restrict salt. So it's not like they're just going to ask you to take less salt and your body will get damaged. That's not going to happen. It is a carefully planned advice. If you follow the advice, you should be fine.
Great. Next is a question which might help a lot of people, doctor. Yashika Agarwal is asking, my father has been asked to go for a liver transplant. How do we go about this? We also do not have a family donor. What is the procedure?
So liver transplant, first you have to register yourself with a transplant center. Liver transplant is done in two ways. One is a donor that is given within the family members. It is called live donor liver transplant. Again, we talked about how the liver has a capacity to heal itself. It also has a capacity to grow itself. That is a very unique thing about the liver. So when a family member donates a liver, around 50 to 60% of the liver is taken out of the donor and given to the patient. And the liver in the donor and the liver in the patient will grow to 90 to 100%. So one liver effectively becomes two livers. So it is a beautiful thing about medicine where one liver can become two livers. So that is a common way to do transplant. But for that, a lot of tests have to be done for the donor and has to match the recipient both in terms of blood group and other ways. So sometimes, even though somebody comes forward to donate, the liver will not be suitable and the transplant doctors will say, we cannot use you as a donor. And that seems to be your situation. The other option is to go for a cadaver or a deceased donor transplant. What this means is that somebody who has a brain death, unfortunately, there are people who meet with road traffic accidents, people who get strokes or bleeding in the brain, and so on, where the brain dies first, and then 2-3 days later, the heart will stop. So, this is an unfortunate situation. But very, very brave and courageous people come forward to donate their organs in this moment of their grief. And these organs can be utilized to save other lives. The heart can be transplanted, 2 kidneys can be transplanted, the liver can be transplanted. Now we are also doing small bowel and pancreas transplant. So all these organs can be utilized to save other lives. And gradually in India over the last 15-20 years, more and more people are donating organs. So unfortunately, the number of organs that we need is far more than the number of organs that we can get through deceased donor transplant. So if you don't have a live donor, then the only option is to register yourself, whichever center you choose to, for a deceased donor transplant. Again, I'm proud to say Apollo and even Tamil Nadu is a leader in deceased donor transplants. So you can choose your state. Every state has laws on disease donor transplant. They have protocols. So whichever state you are registering, they will guide you about the process. So you just have to approach a hospital and get yourself registered. Because the number of organs are less, there is a waiting list. And that's why many patients feel anxious and worried. But that is the reality. So you just have to wait and wait for your chance. And hopefully it will come at the right time. If you don't have a compatible donor in your family.
Done.
I hope that answers your question, but
Yeah.
you just need to approach a transplant center and get them to help you.
Which is very important because a lot of people do not know how to approach transplantive situation. Thank you so much for answering it in very detailed manner. Here's the next question. Alex is asking, my age is 34. I'm feeling I have breathing issue and doctor said because of fatty liver grade 1, my SGPT 112, SGOT 134. Is the breathing issue due to fatty liver?
It's very unlikely that fatty liver will cause breathing issues. But from what you describe, your liver tests are quite abnormal. It's possible you have fatty liver and some damage to your liver. So you may benefit from some treatment and more assessment to find out how bad your liver is. Like I mentioned, all of it, almost all the liver problems can be reversed if treated at an early stage and the right time. At this stage, you can completely reverse your problem and get back to normal liver, normal lifestyle. It's very unlikely the breathing issues related to liver disease. So you just again need to talk to your doctors and work it out. But certainly for your liver, I would recommend you take some advice and take treatment also.
Done. Doctor, a lot of people are asking for supplements for liver. Some right from Live 52 to Milk Thistle to Garcinia. People are asking about these supplements, which will they be helpful?
This is a kind of a myth that is going around in the public for centuries, not just now, that you just take supplements, either herbal or non-herbal, and the liver can be protected for long periods. And a lot of patients and friends I know take Live 52 and 2 pegs of alcohol every day, and they think it will balance out. So it doesn't do that. It doesn't do that. Rather than take supplements, I would recommend a healthy lifestyle and keep yourself healthy, because it will not just help your liver, it will help your whole body. So there are many supplements. Many of them are herbal plant-based supplements. Some of the ones you have mentioned. Uh, they have not been scientifically studied in great detail, but whatever we know of them, they have some healing properties. So, for example, if you develop a viral hepatitis and the liver is inflamed, you have a bit of jaundice. So, some of these herbs may aid in the healing. Like you fall down, you scrape your skin, you put some band-aid. So, body will heal with or without band-aid. But band-aid will soothe your skin. It'll heal faster. Maybe it'll heal 2 days earlier than it normally would. So it's something like a balm or a healing agent if the liver is inflamed or damaged. But for example, you have cirrhosis of liver and you pop liver 52, cirrhosis is not going to go away. It is still going to be there. So it really depends on what you're treating and at what stage of liver disease you take it. So if at all supplements are used, it is used for healing inflammation or mild liver diseases at the early stage. But as a supplement to maintain the liver without getting disease, it probably won't work.
Okay, great answer, doctor. Thank you. Devi Shekhar is asking the next question. This is about hepatitis B, and about 25 years back, my cousin noticed blood hepatitis B was positive, which continued and lasted for 3 to 4 years. But last 15 years, his hepatitis B showed negative. Does this continue? Will he require to take any more precautions?
So in hepatitis B, there are two tests you have to look out for. One is called the HBsAg antigen. This is a marker to show whether you have hepatitis B or not. So if this is positive, then that patient has hepatitis B. It's very unlikely that the hepatitis B HBsAg will become negative. It may happen in around 5% of patients. So if you're one of the lucky 5%, you may clear it over a period of number of years. The second test is something called a DNA test, HBV DNA test. So this DNA test will tell the activity of the virus, whether the virus is active at that moment in time. Hepatitis B can exist in two forms, in an inactive form or carrier, we call it the hepatitis B carrier, or also an active form. So the inactive form will not harm the patient, the active form will harm the liver. So the DNA can become positive, negative, it can keep changing. HBsAg, the hepatitis B antigen, usually remains positive. So I'm not sure what test this person refers to. But if it is the DNA that is negative, then they don't need treatment. But what I want to tell, rather than dwell on individual patients, is all hepatitis B patients should get themselves screened at least once a year with a specialist, because in later years, above 40, 50, hepatitis B can be harmful to the patient. In younger years, may not harm them. And it can be completely controlled and treated if caught early. Whatever the changes that happen to the liver, if there is an inflammation or development of cirrhosis, anything that can be identified early can be completely suppressed and treated. And the only way to find out is to get yourself tested at least once a year. So this is the message I hope all of you will follow. Anybody you know or have hepatitis B, just make sure you get yourself tested with a proper specialist at least once a year.
That's an interesting fact, doctor. And while this is being done on the Liver Awareness Day, the World Liver Day is approaching. So these are very, very important. And what do you want to specifically add in the awareness point of view? World Liver Day on April 19th, what do you want to add and stress upon?
So the three harmful things that
you can give those tips towards the end, but one thing that I still have time for questions. I just wanted to understand now that we're talking about cirrhosis and hepatitis B and fatty liver. Yeah. What is the one thing that on the World Liver Day you want to stress on?
I just want people to be aware of the liver health. So the best way to take care of your liver is to maintain a good weight, exercise, eat healthy, eat right. So by doing that, not only will you help your liver, you will help the rest of the body, because liver is kind of a gateway to other diseases as well. And like we discussed, liver disease can lead to heart disease and cancers. So if you keep your liver happy and healthy, then your heart and other things also will be happy and healthy. So I think that's the best thing you can do on World Liver Day.
Yes, Doctor. Doctor, there are two questions that I would want to combine and ask. Are triglycerides and other cholesterol lipid issues related to fatty liver? Kalipada was asking. And I also saw somebody asking about thyroid issues and liver issues. Are they related?
There are a lot of interrelated conditions which all come under lifestyle disorders. High blood pressure, diabetes, obesity, having high cholesterol or triglycerides in the blood, hypothyroidism, which is not a lifestyle disease, it is autoimmune disease. It is also linked to liver disease. PCOD, there's a condition called obstructive sleep apnea, which comes when you are fat and obese. So they're all interlinked. Having high blood fat, which is either cholesterol or triglyceride, doesn't directly impact the liver, but it is a marker of metabolic syndrome, which is a lifestyle syndrome. That's what we've been talking about. So the lifestyle syndrome is also called as a metabolic syndrome, where patients have diabetes, high blood pressure, high fat in the blood, and they are overweight, especially in the belly. So this combination is called metabolic syndrome. And almost 70 to 80% of people with metabolic syndrome will have fatty liver. So that is a link. So when you have one or several of these risk factors, then you're very likely to get fatty liver also. Because the metabolism, storage of fats, sugar, they're all controlled by the liver. So when there is an abnormality in the entire system, the liver is bound to get affected. And it's true the other way also. If the liver is affected, there's also bound to be abnormal fat, abnormal high blood pressure. So they're all interlinked. So directly, it may not have any impact on the liver, but they are interconnected.
Done. Doctor, here's a question that somebody is asking about. Oh, where did I lose the question? Rohit Negi's question. I'm suffering from NASH and a fatty liver from last 10 years. Triglycerides are high even after losing weight. Is there a problem?
So NASH is what we were talking about. NASH is inflammation of the liver due to fatty liver. So I mentioned 20% of patients will get damage. So NASH is the starting of the damage. So NASH patients need treatment, need follow-up. So lifestyle change will take care of 50% of the problem, or 60, 70%. And perhaps you need some medication as well. So if in 60 to 70% of patients, by losing weight, changing lifestyle, changing diet, the problem can be controlled either with short-term medication or no medication. There are some, they say 30 to 40% of patients who need medication in spite of the lifestyle changes. So those patients like you, who your triglyceride is saying is not coming down, it depends on the level also. There is a harmful level. If it is more than 200, especially 250 or more, or even 200 or more, may need treatment. If it is less than that, it doesn't need treatment. There are good medication that can be taken to reduce triglyceride.
Done. Thank you. And Mr. Naziruddin, your mother's cirrhosis issue must have, it was answered already, cirrhosis and way how to take care of it and diet and all, doctor has already answered. So I will continue with other questions as well. Here's atrophy in segment 4 of liver by birth. Kiran is asking this question. Will this affect me?
Usually not. So there are many variations that you see in the liver size and shape, many times coming from birth. It doesn't always lead to disease and damage of the liver. So again, we never take one test in isolation for liver and for many other diseases as well. As specialists, we never look at one test and say, okay, this is showing this and that means this treatment. It has to be a combination of tests and how the patient is, because the clinical symptoms, the clinical signs, examining the patient and seeing if there are any changes to the liver and around the liver. So all this matter in making a final diagnosis and treatment. So just an isolated finding on a scan may not necessarily be a medical issue. Again, I can only recommend you see someone, ask them to examine the child or adult do some other additional tests to support the diagnosis. And if everything is okay, I'm sure it'll be fine. If they find
He's
something, they
50 year
can.
old now. I just spotted that he's
Sure.
50-year-old.
Yeah, sure. So if he has lived 50 years with this liver, it's very unlikely it's going to cause problem because of this.
Yeah.
Again, if you take care of your liver with lifestyle, alcohol, and so on, you should be fine.
Right. Bharat is asking this question: if I ever had a heavy meal in the night before I slept, I wake up puking green color vomit. Is this
Okay.
dangerous? And what is this?
This is probably not connected to liver disease. So if you're having regularly vomiting, it may be something simple like acidity, reflux, ulcers. So you need to just consult a gastroenterologist and take advice. Uh, but just vomiting at night after meal is not necessarily a problem with the liver. So you
Right.
just see a doctor and take some advice. That may be the best.
Yeah. Srini and Raj, both of them are asking about weight loss methods which are extreme. One is asking about protein supplements, all these herbal, whatever supplements that they get, Herbal Life and all, or meal replacement supplements. And one is asking about intermittent fasting. Will such
Okay.
methods of losing weight help liver or damage liver?
Okay. So weight loss is helpful for liver if you're overweight and have fatty liver, but weight loss in general is a good thing to do. So there is an ideal body mass index, which is the height to weight ratio. So if your body mass index is less than 25, then you're reasonably healthy. And also to make sure that your belly fat is not too high. So if a particular person is overweight, wants to lose weight, there are many ways to do it, like you asked. As doctors, we don't believe in shortcuts. We believe in a balanced diet and the hard way. So we don't recommend shortcuts, easy options. So the best way is to eat less food overall and eat more right kinds of food. So you eat more of vegetables and fruits, eat less of carbohydrates, fat in moderation, and extra proteins. So this is a balanced diet. Most important is to eat less of everything. There are apps to work out how many calories you need in a day. So you can use those apps and work it out. You can meet a nutritionist or dietitian and work it out. You can just Google and figure out how much you need to eat. And there are ways to count, like you eat two rotis, how much calorie in two rotis. You eat say half a cup of sabji, how much calories. There are apps to guide you and all that. And once you do it regularly, you'll get the hang of it. So you'll know, okay, I'm eating too much, let me cut down. So the most important thing is number of calories. There are many approaches to diet. There is a Mediterranean diet, there is the Atkins diet, there is the keto diet. So they're all diets. What I recommend, and most doctors will say the same, do something that you can stick to for many years. Because if you
Right.
do something too fancy and too drastic, you'll do it for a month, 2 months, then you get fed up and just eat with a vengeance more than what you normally would do, and you go back to square one. So whatever you do, make sure you sustain it. Anything that is too drastic is not good for you. I don't want to individualize diets and say good or bad. Anything that is too
Right.
drastic, too out of the way is not good for you. So best is to go balanced, go slow. Second most important thing is exercise. Whatever you do with your diet, keep exercising, because without exercise or activity, it's very hard to lose weight. So you do weight. Intermittent fasting is not a bad option, especially to kickstart the process, but make sure you can sustain it. That is the main thing.
Great. Doctor, one last question before we get to top tips. Somebody is suffering from gallstones and gallbladder issues, and how does this affect my liver?
Okay. So gallstones are not directly connected to liver disease. The one way it can affect the liver is sometimes the stones slip out of the gallbladder and they go and block the tube that brings bile from the liver. And that time it can cause pain, infection, jaundice. Other than that, directly it will not affect the liver. Gallstones, the most effective treatment is to remove the gallbladder. It is done through laparoscopic surgery. We recommend gallstone surgery if the patient is having symptoms or a damaged gallbladder because of the stones. So if you have gallstones, just check with a surgeon or a specialist or a doctor whether you are having symptoms. Usually it is pain, and let them do an ultrasound and assess the gallbladder. If the doctors treating you feel that the gallbladder is causing symptoms or it is damaged, they will recommend a surgery to remove it. If it is not causing any problem, then you can wait.
All right, doctor. Thank you so much. You were really very patient. So before I take
Thank you.
leave from you, I would want you to give us three habits which can harm the liver and also three tips to take care of the liver.
Sure. So I think harmful things we talked about in detail. So I'll just emphasize three things. I think one harmful habit we all do, including me at times, is overeating, less activity, and some people drink too much alcohol. So certainly this is a harmful lifestyle habit that damages not only the liver but other parts of the body. But a lot of it happens in the liver. So that is one thing. Second thing is self medication. Again, this is a habit which is more prevalent in India, where you can just buy drugs off the counter, and many people are in the habit of self medication. Many of the medicines are harmful to the liver. The liver takes care of almost 90% of the medicines, but sometimes it can harm the liver. So don't take unnecessary medication by yourself. And the third message is for the youngsters, because there is still a use of IV drugs and IV needles in public places, whether it is for recreational drug use or body piercing, tattooing, and so on. So these are practices that can spread hepatitis B and C. And we do see pockets of India where this is highly prevalent. So I urge youngsters to be aware of this. If there is a option to use needles in public places, it has to be in a hygienic, properly controlled environment. So these are three harmful things I want the public to be aware of.
Great, Dr. Murugan. Thank you so much for this wonderful session. It was really enlightening, and I hope everybody takes care of their lifestyle and also take care of their liver, which takes care of them. Thank you again for a Sunday morning session. Thank you, Doctor.
Thank you. Namaste.
Right, and that is Dr. N. Murugan, who gave wonderful insights. And now it's your turn to answer questions. We're going to give you 3 questions in the health quiz. You can answer the questions on YouTube chat. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And once you're announced as a winner, you should be writing back with your details at marketing@apollo247.com, and gift vouchers will be shared with you. Chalo, get ready. 3 questions I'm going to ask. Here they are on your screen. The first question for today is, which digestive liquid or fluid is being produced by liver? Which digestive liquid is produced by liver? Question number 2, when is World Hepatitis Day being celebrated in 2022? When is World Hepatitis Day being celebrated in 2022? And the last question for today is, which option on Apollo 24/7 app allows you to book a lab test and get up to 60% discount? Very simple. If you have Apollo 24/7, go and check what it is. Which option on Apollo 24/7 app allows you to book a lab test and get up to 60% discount? These are the 3 questions for today. Please type your answers in the YouTube chat box and let the team pick who the winner is. Meanwhile, while the winners are being selected, let me give away the coupons for today. The first code that you can use on Apollo 24/7 app is code FIRSTVC. Direct from Apollo, you can get doctor consultations on your first online video consultation with Apollo Expert. You get 150 rupees off. So for this, you have to download Apollo 24/7 first and then use the code FIRSTVC. This is a great offer. Make sure that you have it on your phone, and also all your family members or your friends have this on their phone. Well, the next coupon that we are giving off today is FIRST3. Use this code FIRST3 on Apollo 24/7 app. Again, get 25% off on online medicine orders. There are certain terms and conditions which apply, but you can avail up to 25% off on online medicine orders. Use the code FIRST3. Well, every week we give away these coupons. Please watch the show, because there are different coupons that we give. The first week has the coupon, second week has something else, and special days also have different coupons. Now also let me give you the coupon, which is HH247. Use this code and get 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders. The code that you use is HH247. And while I'm waiting for this week's winners, I hope a lot of people, all right, a lot of people have answered. Deepak, Sakib, Anand, Vinay, all right, a lot of people have been answering. Let me see who the winners are. Before the winners come, let me tell you what the topic for next week is. Next week, we are going to talk about diabetes, how to effectively manage diabetes. We are bringing you an Apollo's expert. Tune into Health Hour on 24th April, 11 a.m. If you don't want to miss this session, go ahead and subscribe YouTube channel and you will never miss a session. You will get notifications. And this is a very, very important topic, how to effectively manage diabetes. We shall see you next week on this chat. I'm still waiting for the winners yet. I don't see the winners' names flashing on my screen yet. The team is still doing it. Yes, I got them. The winners are Saurabh Gupta, Raju123 Full, and Parul Kaur. Congratulations. Please do write back to us at marketing@apollo247.com and claim your gift vouchers. That's it for today, folks. Thank you so much for asking your questions. Your question was answered for many people, and I hope, if your question wasn't personally answered, also you got an answer of your query today. Thank you so much for joining us. See you next week. Namaskar.